story tonight, less than 24 hours after the CDC announced its updated childhood immunization schedule. Many health experts sounding the alarm about this. The new recommendations slash the number of required vaccines for your children and now creates new categories for others. Our Dennis Valera joining us now in studio tonight. And Dennis, a Johns Hopkins expert says he was shocked with this, but really not surprised by the update.
Yes, Rick, for Dr. William Moss, his biggest concern is this update could lead to larger mistrust in vaccines and lead to dangerous impacts like lowered vaccination rates. But he also says Marylanders will likely see no changes.
When the CDC decreased the number of required immunizations for all children from 17 to 11, it said it did so to strengthen transparency and trust with federal health leaders. But Dr. William Moss from the Johns Hopkins Bloomberg School of Public Health says the evidence isn't there. He's also the director of the International Vaccine Access Center.
These changes were made without the transparency, without providing the evidence base, without telling us, what was broken and what are they really trying to fix.
Aside from decreasing the amount of required immunizations, the CDC also created two new categories of vaccines, one reserved for children at high risk for infections and another group of vaccines that should be consulted first with a healthcare provider. Some of those vaccines include flu and COVID-19. Dr. Moss says whenever you add steps to vaccine access, it often leads to lower vaccinations, which can lead to outbreaks of vaccine-preventable diseases.
It can create some confusion and question among caregivers. And so I do think it will lead to, in some states, to reductions in vaccine coverage, hopefully not translating into large or more frequent outbreaks.
In response to the update, the state health department issued a statement that it would follow the American Academy of Pediatrics guidance, saying in part, Maryland remains firmly committed to immunization as a core public health priority and will continue to take the necessary steps to ensure broad vaccine access in the state. According to Dr. Moss, accessibility is key.
As long as the vaccines are still accessible, then I think not a lot will change for parents in Maryland.
Now, another reason Dr. Moss says he doesn't think things will change for Marylanders, the CDC says insurance providers will continue to cover the cost of vaccines regardless of category. Back to you.
All right, thank you very much, Dennis. According to new data from the CDC, doctor visits for flu symptoms have reached their highest level since the 1997-98 flu season. All but 4 states are showing high or very high levels of activity as a new virus strain called subclad K continues to spread, and the worst could still be to come.
And we're still about a month or so away from the typical peak of flu season, which occurs in February. And so it's not too late to get a flu vaccine. This can be tremendously helpful and effective at preventing severe disease that requires hospitalization.
The CDC recommends everyone 6 months and older who has not yet been vaccinated for the flu this season get an annual flu vaccine.